Well, good afternoon, everyone. And to kick off today's COVID-19 update briefing, I'll start with some good news. Illinois has set a new all-time testing record with over 95,000 tests in the last 24-hour period. We're going to keep pushing that number higher and higher so that tests are as available to you as possible, whenever and wherever you need them. Find the site nearest you. If you'd like to get a test, go to online dph.illinois.gov/testing. As of this morning, Region 6, East Central Illinois, has now sustained an average positivity rate of 8% or higher for 3 days in a row. Today hitting a 7-day rolling average of 8.6%, meaning that starting Monday, they will join the majority of the state in operating under resurgence mitigations. That's up from 5.2% in mid-September, the summer peak of 6.2% over Labor Day weekend, and the all-time low of 1.1% in late June. And the region's COVID-related hospital admissions today have tripled since mid-September, up to an average of 18 per day from just 6 per day. As I mentioned yesterday, we're deploying mobile testing to Region 6 throughout the weekend in Richland County today, Effingham on Sunday, in Macon at Decatur Civic Center today through Sunday, and next week, Region 6 will have a testing site from Monday the 2nd through Sunday the 8th at Danville Area Community College. Again, go to our testing site on the DPH website to find a testing site near you. Region 6 is our 10th of 11 regions to require additional resurgence mitigation in recent weeks. The final region, Region 2, which includes Peoria and Rock Island, today crossed the 8% positivity threshold for the first time, reaching a new 7-day rolling average of 8.5% as of today. Barring an unlikely reversal of that trend, 2 more days at or above that 8% intervention threshold will bring Region 2 into mitigations in the coming days. Once again, this is a problem that is affecting the entire state. I'd just like to remind parents and kids alike to make good decisions tonight and tomorrow for your continued good health. Find new ways to celebrate the holiday while staying safe from the virus. And make sure you find a way to build that surgical or medical mask into your costume. The safest way to do Halloween this year, of course, is virtually and from home. That said, for those who want to find more of a middle ground, IDPH has put forward and provided some ideas for how you can have a safer neighborhood trick-or-treat event. That's available on our website in both English and Spanish at dph.illinois.gov/COVID-19. In the end, whatever fun you choose, please remember this virus does not make exceptions for holidays or because you want to take a break from it. With community transmission rates on the rise all around the state, it's more important than ever to take caution, mask up, avoid gatherings, and ensure your family gets through this as safe as they can be. Think seriously about whether you need to be going out to celebrate at all. And if you decide to go out, keep as much of your activity outdoors as possible and remain masked. Let's remember that the quickest way that we get our kids back into schools and businesses open and workers employed is to bring down infections and positivity rates and hospitalizations in our communities. And that means mask up, wash up, back up, and sleeve up to get your flu shot. Before I hand over the podium, let me take just a moment to say that I know you hear those words, mask up, keep your distance. You probably hear those from me virtually every day. You see them around your neighborhood, and from local officials you hear them. In many ways, For many people, I fear they've become like background noise. So let me just remind you of what they really mean. Almost 2 months ago here in Chicago and again in Springfield, I joined faith leaders of every background in a memorial service to honor the 8,000 Illinoisans we had lost at that time to this virus, along with a handful of families who courageously shared their stories of their lost loved ones, allowing us all to grieve with them for those that we've lost. It is a great indignity of this disease that it has also stolen our traditional and more profound ways to mourn. Full-hearted gatherings of loved ones, coming together for the funeral and memorial services that often do perhaps as much for the souls of the living as they do for the dead. At those services in September, we heard directly from some of these families. We bore witness to their pain, a pain that now gets twisted and tormented by the people who go around and declare that efforts to prevent further loss are an assault on their freedom. Whether or not you've lost someone to this virus, it's okay to grieve. It's okay to feel despair. It's okay to feel that the world is crashing down upon you. Even if you look left and right and wonder, is it fair for me to be feeling this way? Yes, it is fair to mourn the losses, the wrenching loss of life, but also the loss of our ways of life. Everything we are experiencing as a state, as a nation, as a world, it is so hard for so many people. And it's harder still when some people act as if the loss of those we love, now nearly 10,000 Illinoisans, more than 230,000 Americans, more than 1 million people worldwide, is less of a loss because of their own personal circumstances. So when I ask you to wear a mask, when I ask you to take care of your community, it's not because I think it's fun to ask. It's because I've heard directly from those who have lost someone that they love, those families whose normal is never coming back, vaccine or not. It's because I don't want any more people to experience that horrible scalding pain of life lost too soon. A pain made all the more unbearable when the world turns its back on ways to help. The stories that these families share about how their lives are less whole because they lost someone to this pandemic, well, that's what makes me cry. So please, do what it takes to show that you care enough to help where you can. It just might save a life. It just might save you. With that, I'd like to turn it over to the Director of the Department of Public Health, Dr. Ngozi Ezike. Doctor.
Governor, thank you for those powerful words. Good afternoon. It's Friday yet again. The cases continue to increase, the hospitalizations continue to increase, and the deaths continue to increase. People can look at the numbers however they want to, make their own calculations, insert their hypotheses, but we're not going to deny that hospital beds are being used at a higher rate. Please ask any hospital executive across the state. We have more individuals in the ICU and we have more people on ventilators compared to just a week ago, 2 weeks ago. Overnight, 3,092 individuals were in hospitals across Illinois with COVID-related illness, and of those, 673 were in the ICU and 288 patients were on ventilators. Today, we are reporting 6,943 new cases of COVID-19. We've also been made aware of 36 additional deaths. To date, a total of 402,401 confirmed cases have been reported in Illinois and 9,711 deaths. As the governor mentioned, in the past 24 hours, more than 95,000 tests were reported for more than 7.6 million tests. As the governor also highlighted, it's great to see this record number of tests, but what the results show are grim. But even though the numbers are grim today, I'd like to remind everyone that the future is not fixed, and what we do today directly impacts tomorrow and the tomorrows after that. We still have the pen and the ink to author new chapters in this already sad, non-fictional narrative. But with our pens and our ink, we can write better chapters going forward. Please wear a mask today. Help prevent yourself and others from getting COVID-19. That will mean less hospitalizations in the future and less deaths. In a pandemic that has dragged on for more than 9 months, and with the numbers all going in the wrong direction again, it's easy to feel discouraged. We all feel discouraged, but you shouldn't feel like there's nothing you can do. There is something you can do. Public health officials might be running out of options, but you have the most powerful options within your toolbox. And it's the things that we have been saying from here, but we all have to do them. So please, let's take hold of our collective power. Let's take action today. Let's wear our mask. Let's watch our distance. Let's wash our hands. And my new W, let's wage war against flu by getting our flu shot. I know it's Halloween weekend, and I'm urging you to make pandemic-guided decisions, as the governor recommended. Indoor Halloween parties are just not likely to be safe. So let's do the right thing so that our next holidays will not give us a reason to mourn.